Welcome to today's episode. We are diving into the fascinating world of TCM, the clinical practice, exploring the interesting cases, challenges, and also the memorable patient experience. Today, we invite Dr. Ting-Yu Huang, a TCM doctor from China Medical University Hospital, here to share some amazing story with us. Dr. Huang, can you give us a brief introduction for yourself?
Hello everyone. So I'm Ting-Yu Huang, and I currently work at China Medical University Hospital, TCM department, the acupuncture department. And mostly my patient group are musculoskeletal pain and like sports injury. Yeah.
所以黄医师呢，他是我们中国医药大学附设医院中医部的针灸科的住院医师。那他本身厉害专长的部分是什么？就刚刚提到说是肌肉方面的疾病。还有呢？
另外就是还有就是因为个人喜欢爬山嘛，所以就是对登山的医学会比较有涉猎，然后还有像是心脏也算是我比较有兴趣的跟有涉猎学习的领域这样子。
So sometimes, acupuncture treatment for sport.
Yes, and for cardiology, and high altitude.
Okay,
problems.
Great. Yeah. Okay, great. So yeah, here can you share some cases? Such as like funny or unexpected the moment in your clinic, because some unsurprised or unusual the request from the patient made. Some cases maybe you can share with us.
Oh, okay. So, in TCM clinics, often we are thought as like we can diagnose anything with fingers.
Oh,
so. I do not often have these type of patients, but occasionally they do occur. And especially when in the past I was learning as a student, I studied with like some more senior doctors, and they had more patients who are for internal medicine purposes come to our hospital. And for these patients, you would often see that they come and say nothing and just give the doctor their arm and say, yeah, they just say nothing and just give their arm. Yeah. And they are expecting that you just take their pulse and start saying, oh, you have a weak pulse and you didn't exercise yesterday, or you did something bad. You drank too much yesterday. Yeah.
So it's been the patient. He expects, the doctors will give him any kind of information just through the pulse diagnosis. Is it possible?
It is. I would say the pulse does give us some information, but it cannot tell us everything. Because so in medicine we have something which we call baseline. So everyone has their own baseline. They have what we call their normal situation. And the pulse at that situation is normal for them. And a diseased pulse is a deviation from the baseline. And so perhaps your baseline is not that low or not that high. And compared to another person, you would be relatively high or relatively low. But if we do not know anything about you, then we can only guess from a general population what your pulse means.
Oh, okay. Yeah. Okay. So, in the TCM clinic, I think and we have 4 methods for diagnosis. We call it 望闻问切. Yeah. Yes. So it means 切 is mean the pulse diagnosis. And the 问 is mean the doctor also will ask some questions to patient, right?
Yeah.
And then the patient should be give some, the basic information about currently the situation and the body situation or something information. I think it's also very important to give this kind of data to the doctors, right?
Yeah. So when a patient walks into our door, then we start with the 望闻问切 process. Wang is the inspection. So when he walks in, we are already, especially in my case, for example, if you have a patient with ankle injury, then when he walks in, you would know how severe his ankle injury is.
Okay.
Because, for example, if he's limping, or if he is with a stick, or if he can walk on himself, walk on his own leg, then it's very different how he walks in. And that would tell us something about how severe the injury is. And so without post-diagnosis yet, we would already know about his injury. And okay, in the sense of internal medicine, like for example, I have some heart failure patients, then if you see them walk in today and see them walk in next week, you would see that they are breathing at a different pattern, with a different pattern or at a different rate every time they come. You would already know whether they have improved or deteriorated in the past week, even without them sitting down yet. So that is the inspection part. And the second is called, in Chinese called Wen, and Wen in English can be with two meanings. The first meaning is smell, and the second meaning is listening. So with smell, there was one case that I remember very, very, it was very strong impression for me. So it was also in the emergency department when I was still a clerk in Western medicine. And so this was like a 50-year-old man. And when I approached his bed, like 2 meters from his bed, I started to smell very, very strong fragrance. And I was like, oh, this is a 50-year-old guy who likes to use fragrance. I was like, oh gosh. And when I started to go closer and closer to his bed, it was like, oh my God, how can you use such strong fragrance? And later I found out, oh, it's not fragrance. He has DM. He has diabetes.
Okay.
So it's the smell caused by
lactone.
Yes.
Yeah.
It's the smell caused by lactone. Yes. So in textbooks it tells you that it smells like rotten fruit. But in actuality it smells quite great.
Oh.
Yes, it's interesting. Yeah. And so that's smell. So sometimes you just smell the patient. And also listening, you could, when the person starts to speak, you would know. For example, we have a lot of stroke patients in our acupuncture department, and some of them have aphasia, which means that they cannot express themselves properly. And the other is called dysarthria, which means that they cannot speak in a clear way. When I mean speak in a clear way, means that they would say something like this. Their grammar is proper, but their pronunciation sounds strange. But for patients with aphasia, their grammar is just a mess. So when they speak, we would know which their problem is. So the next part would be inquiry, with the 问诊. So concerning post-diagnosis, we discussed just now that in post-diagnosis we can know a lot about this patient, but for same pulse, it can mean like maybe 10 different things. However, we can narrow down maybe narrow down to 2 or 3 of these things with inquiry, and the previous like inspection and smelling and listening. We can use the previous information to narrow down which the pulse means. So that is why in our diagnosis process, we do not just ask you to stick your hand out and guess everything, because we may guess it right in like 60 or 70% of the time, but sometimes we just can't get it because you have too few clues about what exactly is going on.
所以下次去中医诊所的时候，去中医看病的时候，千万不要把手伸出来而已，然后就让中医师去猜。So it's not only the guessed by the doctors. You also need to provide the different kind of information to doctors to give for the reference.
Yeah, if you provide us more information, then we can give you a more precise treatment.
Yeah, it's correct. Yeah, and also have another special cases, maybe also something interesting.
So this there are some cases that I feel that as a doctor I feel very uncomfortable about. Yeah, so it was like a few days ago. This patient came to my OPD. Well, she's quite a good person, but she came to ask a request which I could not give. So she had a traffic accident like a month ago. So after the traffic accident, she went to a local TCM clinic to perform acupuncture and traumatology treatment. And after like a few sessions, she went back to work. And at her work, they said that you have to provide some kind of certificate to say that you really went for the treatment. And so she provided the certificate from the clinic. And her company just said, "Oh, we don't use the certificate from clinics. You have to go to a hospital to get one." Yeah. So I could understand her position because she really needed this certificate to cancel out her 请假.
Okay.
Yeah. For taking her days off. She took like 3 to 7 days off work, so she really needed the certificate for
the application.
For that process. So she came to my OPD and asked for this. But from our perspective, it's weird because she asked me to write in the certificate to say that she received TCM treatment like a month ago. And for me, it's strange because she needed me to write that she needed 3 to 7 days off work due to the traffic accident induced injury. And from my perspective, I can only see what is happening now. I do not know what happened 1 month ago. So from my current situation, I would not be able to determine at that time whether this patient was able to go back to work immediately or she really needed that amount of time off. So eventually we had a deal and I rejected her. I said, okay, sorry, I can't help with this. Yeah.
Okay. So normally, maybe most of the patient, they believe that, the doctor, even the TCM doctors also can do anything, even this kind of certificate, just not do it in your clinic, but they also saw that you can do it for them, right? But there's not really everything can do it by ourselves.
Well, we can provide certificates, but we can provide certificates from this time point on. So we cannot imagine what the patient was in the past, but we can look at your status now and see whether you would need more rest from this point on.
就是说诊断证明只能开现在的，对不对？就是你现在的状况，你可以开出来诊断证明，但之前的其实我们就没办法，因为那个不是我们经手的，也不是我们所知道的状况。
所以就是如果要开诊断证明，就是如果你长期都在看这个医师但一开始他的状况看过，所以他要回溯性的去开，对他来说是还算合情的范围之内，他可以通融，因为毕竟他一开始就看过你的状况。但是以我遇到的案例，有时候就是会有这种比较极端一点，就是他希望
突然冒出来的，
对，他希望你回溯1个月前的事情，这对我来说是不可能，因为我不知道你1个月前发生什么事，我只能依就你现在的状况来说，你现在适合回去工作，还是你还需要休养？但这个对这个患者来说，就是对他比较抱歉，没有办法帮他请假这样子。
了解。那当然，其实呢，我们就知道，其实如果你长期给一个中医师来做这样的一个 诊断治疗甚至维持的话，其实是一件好事。他可以了解你的身体状态，那甚至有需要这种状态的时候呢，他也可以帮你协助你。Yeah, so it's good we have the clinical, the TCM doctors to take care of you, not only for the treatment, not only for the diagnosis, also for the health maintenance. The TCM doctors also can give you any kind of, information and give you some advice to say, okay, how to maintain your health. In these cases, if this patient, she was, your patient for a long time, maybe you also can help her because her situation for a long time already. Yeah. So in that case, sorry, yeah, for her, sorry, it's not impossible. Yeah. Yeah. 所以呢，其实真的找个好的中医师呢，来当做您的家庭医师是一件好事。So it means good. If you can find a TCM good doctor, TCM doctors to be your family doctors will be good. Yeah. So welcome. Yeah. Thank you very much for your today the conversation. And if the people want to looking for you, to give you to want to receive your treatment or any kind of the healthy maintenance of the advice, where can I find you?
So I currently work at China Medical University Hospital in the acupuncture department. So I can be found online, and you can just make a reservation online or via our CMUH application.
所以要找黄医师的话呢，请上我们中国医药大学的附设医院中医部针灸科，那你可以找到黄廷宇医师的门诊的资讯。Okay, thank you very much for today for sharing.
Yeah,
thank you very much.
Thank you.